My name is Beverly Nemhart, and I'm a health navigator with the Cancer Coalition of South Georgia.
Hi, my name is Elizabeth, and I was diagnosed with colon cancer. I never owned it, so I just said I was diagnosed with it. I went to my regular doctor in Newton, and Jim, he is so wonderful. He said, "Have you ever had a colonoscopy?" I said, "No." He said, "You know, women have colon cancer too." I said, "Yeah." He said, "Well, I tell you what, it's a program that they started here, and if you're interested in it, we can get you set up and get you on that list so you can have your colon did." I said, "Okay, that'd be fine with me." So that's how it all got started. She helped me a whole lot. After I was introduced to the program, and she called me, and whatever appointment I needed to have, she would call, set it up for me, call me, remind me of it. And she was just like my right hand. She was real good help for me. Yeah. You know, without Beverly encouraging me, telling me, "Okay," and then she would say, "I call you to see how you doing, and you helping me." It wasn't pleasant, but I did it because of the fact, you know, I wanted to make sure. So, with the little flavor packs, it made it much better. But believe me, that is nothing that anyone wanted to do. But it was okay. I mean, I didn't mind it because of the fact that it was something to help me.
Right. And that's one of the things that, as a navigator, I try to help patients understand. That's probably the hardest part of going through the procedure at all, is doing the liquid diet and doing the bowel prep to get your colon clean. But it's also the most important part, because the gastroenterologist wouldn't be able to see your colon unless it was squeaky clean. So that's a part of the whole process. And just being a support there and letting the patient know that they made a good choice and that they can do it, and that this is something that is really important, and it helps just to have someone to talk to about it, and that they can ask questions and not feel like, is this a stupid question?
Well, when I first went and had my first one, they said they found something, but they wasn't sure. So they said, "Come back in 6 months and we'll have another one." I said, "Okay." So I went back in 6 months, and they did another colonoscopy. They say, "Well, we found it, and you do have colon cancer." I say, "What you gonna do?" Scheduled. I went to see Dr. Kinsey, and he said, "Okay, I understand you have colon cancer, so what you gonna do?" He said, "You know, you have to have surgery." I said, "Okay." He said, "Well, then when?" I said, "Whenever you schedule it." So he said, "How about the 16th of February? That was the next week." I said, "That'd be fine." He said, "Okay." So we had surgery, and every time he come in, he said, "You're done good." He said, "Yeah, wonderful. You're not hurting, no pains, no nothing." I had no pains, no aches, no nothing. Really, in the beginning, I didn't have anything, any problems, anything. So it basically was like something that was meant to happen for me to find out before it got serious enough, you know, to cause any problems. So I was thankful for that. After that, I went on into my chemo. It was okay. You know, I didn't have any problems with that either. Basically my problem with that was the sitting there that long time. That was my biggest problem, really. I didn't have any other problems because, you know, I knew that this was something I had to have in order to get me back on the right track. So, no, not as early as I did. It probably come to the point where I would have to have it did because I probably was having complications and problems. And that was a blessing to know that I didn't have to go through that. So, what would have happened probably would I would have gotten down, and it would have caused a whole lot of problems because my family basically depends on me, you know. I feel like if this hadn't happened at the time that it did, it would have caused a whole lot of problems for me as well as for them, because they wouldn't have had anyone really to carry things on. My sister, she went in 2 months ago when her screaming dead, and I talked to a couple of my friends, and they've had, you know, they said, well, then we're going to check into that and look into that. I said, yeah, because the sooner the better, because, you know, like you say, you know, if you get to the point where you're having complications, it may be too late.
And like Ms. Carey was saying, she wasn't having any problems when she had the first screening. And even when you were found, when cancer was found, she wasn't having any problems. So it's really, really important to have those screenings done. And a program like this, I think, is important. And like I tell all the patients, it's not us that's doing it, because you have to first decide that you want to do it, because this is voluntary. You don't have to do this. The primary care provider asks you if you're interested in it, they recommend it, and you can say no. You could just say no and keep going. But to say yes and to go through and to follow through with the doctor's recommendations and the gastroenterologist's recommendations, it benefits you to do that.
Thank you all for, you know, having this organization, because it is wonderful. Because like without this, mostly people like myself be on like a low scale income, and to find out that you have, you know, cancer, something like this not only is a dramatic burden on you, it's also a strength, because you have to pay these bills, and, you know, you have to try to concentrate on how am I going to pay these bills. So like it's nice to know that there is people out there willing to help you go through things, whatever, you know, problems that you have. It's nice to know that there's someone out there that can say, okay, don't worry about it, you know, we can help you go through this. And it's nice to know that. And I appreciate it, because I don't know what I'd have did without it, really.